So recovery was a ride, and it is still a ride. I am currently 2 months out from my procedure. There's a couple things that I wish I knew going into the double mastectomy with direct-to-implant reconstruction. That it's not just you're getting new boobs, this is great, your old boobs are gonna be gone, the cancer is gone, you get new boobs instead, good for you. Like, that sounds really nice and idealistic, but what we're really talking about is an amputation and a prosthetic. If I looked at this more as an amputation and me receiving a prosthetic than a cosmetic procedure at the end, I think my mental mindset would have been a little bit better through the roller coaster that I went through after my surgery. I was, unfortunately, in that 1% of patients with these two doctors who had a little bit of necrosis. And though it wasn't the ideal situation, I was so doted on by Dr. Cassileth in particular that I was not concerned about the continued decline of my breast. I feel very, very lucky, and this is something that makes me emotional, is I happen to land into the best care in, I will argue, the world when it comes to breast cancer. There's a lot of people who are not that lucky. And I was also lucky enough to be able to crowdfund to afford whatever necessary surgeries and aftercare was necessary. And there's a lot of people who also don't have those resources. I continue to feel the pull in my spirit to try to help facilitate others coming to Bedford and receiving this care, because I really don't think I would have had the same outcome if I wasn't treated by this particular team. So though my journey in cancer is not over, I'm still healing. I'm still on a road to recovery, but my life trajectory is completely different. I don't take BS like I used to. I feel like I'm really trying to live within my purpose and live very intentionally, and I think that my experience at Bedford has added an additional layer of purpose in my life to help other patients that have experienced or are currently experiencing cancer diagnosis, and really just, help create a community and help people achieve the same results that I got. There's one thing that I would say to patients who are going through the process of reconstruction or have a reconstruction surgery upcoming, like, patience is key. Your results 1 week, when you look at your chest, it's not going to be the same body anymore. And that's something that you have to contend with and really learn to love and accept the new version of yourself. But patience will get you through. My body looks different as it did a week after surgery, a month after surgery, now 2 months after surgery, and I know that it'll continue to evolve as we get further out and I continue to heal. But we do not go from the before pictures straight to the after pictures. There is a whole myriad of things that happen in the in-between that I think need to be represented a little bit more, and really just help set people up for success mentally, that it is a roller coaster, and after you receive your cancer-free results, if that's something that you are lucky to receive, that doesn't mean that your journey's done. Survivorship is its own experience, and yeah, I think that's just something that we need to focus on with support a little bit more.